kind of conception itself, right? Or fertility and getting pregnant. Do you, Dr. Sheela and Dr. Usha, want to talk about that a bit to explain to people in simple terms why that happens? And then maybe you can start, Dr. Usha, and then Dr. Sheela, you can tell how people can manage that.
So I'll defer it to Sheila, but very quickly, just that the main, thing is that an ovulation or they're not making the eggs.
Right.
That's the, basic problem. So we need an egg to get pregnant. So that's the biggest issue, with, women with PCOS and some other issues like prolactin and then, short luteal cycles and stuff. And Sheila, if can talk about that probably.
Yeah. Yeah, the main problem is, of course, like Dr. Usha said, it is anovulation, right? So that is the reason why the periods get so delayed. And the amount of the hormones that are produced as well, it's a hyperandrogenic environment, which means that there are male hormones are elevated. So even when they do conceive, let's say with some help, the chances of early pregnancy loss, early abortions, or if they carry their pregnancy further, the chances of having a low birth weight baby, intrauterine growth restrictions. Then on the other hand, diabetes, gestational diabetes, high blood pressure during their pregnancy, going into PIH and eclampsia or fits, all of these chances of all of these happening is much more for a patient who has PCOS. So her pregnancy itself, while it's difficult to begin with, getting pregnant, the pregnancy itself is a more of a problematic pregnancy than for a woman who doesn't have PCOS, right? Because her hormones themselves are completely awry and it's not really supporting the pregnancy the way it should, right? And in all probability, she's been through maybe infertility treatment, where she's already had a whole lot of other hormones to get her pregnant. So all these issues are there. So my advice is always, try and, especially if the woman is young, some of them come with, diagnosis of PCOS and they said they want to get pregnant. I always tell them to try and get their own body into some semblance of, you're not cured of it, but at least some semblance of health, where at least you learn what to eat, what to avoid, more importantly, how much to exercise, how to manage your stress, how much to sleep. Get a hang of that first before you try and conceive, because post-pregnancy itself is a stressor for the body. Right. So you try and get into a healthy state before you get pregnant and before you start off all the treatment for infertility as such. And the amazing thing is, some of the time when they just start getting healthy, get their health in order, get their diet, get their exercise, they conceive spontaneously.
Right.
And that's the amazing thing. And then, they're so thrilled about that. They don't need all the hormonal injections and things like that. It's very empowering, really.
And is there, I remember reading somewhere that a 5% weight loss itself kind of
increases the chance of pregnancy. So I think for a woman, a lot of the time, as far as I'm concerned, I think empowering her to take care of herself is far better than just treating her with medication. So she gets a hang of how to take care of herself. It enables her to take care of her child as well, because a lot of the time the food habits of the mother, that's what is transferred to the child, because the mother is doing the cooking. A lot of the time a mother will bring her overweight adolescent or a young daughter and say, doctor, she has PCOS, but the mother herself is overweight. And she's, probably cooking really badly at home, and the entire family is eating badly. So targeting just the child is, it's not going to solve the problem long term.
Right.
I think this is really not just an individual problem; it's a social problem and a cultural problem as well.
True. Yeah. No, I think our food habits are a cultural problem. I think.
Yeah.
country. And we also believe that we show our love through asking
Food.
people to eat more.
Food,
So I think that's a factor as well.